I came in, I could not find any parking. I went around and around. I said, okay, just go across the street. If I don't find one, I'll go further and further. And if not, just go home. You know, what else can I do? So in any case, the lecture tonight is about the brain and all the problems with it. And that's a special lecture. And to prove to you it is a special lecture, that's how much material I have for it. And of course, you saw me sitting back there, and I cannot figure out what I'm going to be talking about. So what I did, I just prayed, and I said, God, give me a hand in that, because that's a big lecture. And try to cover everything in the brain in 90 minutes. In a language that everybody understands, with a message that they can apply to themselves and their family, it's not easy. But I have done it for 30 years. Hopefully, we will achieve it tonight. The main thing is about the brain, which I do have lots of things here. We're talking about memory problems. We're going to be talking about anything goes wrong in the brain, like Parkinson, migraine, MS, ALS, Alzheimer. You name it, it's a one brain. Are you following me so far, or you're not good? Okay, you get it. That's good. You took your medicine, your nutrition. So if we can protect that brain, then we can enjoy it up to the last minute of our life. If we cannot protect that brain, it doesn't matter how much money you have, it doesn't matter how good school you're going to or how good your doctor. Some people will tell me, I'm going to be okay. My doctor is a professor, so-and-so, and so-and-so, and so-and-so. I said, well, it doesn't impress me, because what impressed me is the result. If he's so good, if the doctor is so good, how come he's so bad? You know? And he said, maybe it's my parents. I said, they did. You want to join them, or you want to do something about it? You probably, Shaklee people here, have heard that so many times. Your nutrition people here heard it so many times that you tell somebody something and they always have an answer to it. Either a negative answer to it. Are you following me or no? Yes. Either say there's nothing you can do, or my parents give it to me, or I'm already far enough, I can do nothing about it. That kind of person, what you do, leave him alone and find somebody else. If it's your mom, if it's your dad, if it's your husband, if they're your kids, you leave them out of it. You concentrate only on number one, which is you. Because when number one goes bad, number two doesn't care. You follow me or no? Number one is you. Number two are your kids. Not your parents, not your husband, are your kids. You made them, you love them so much, and you raise them, but they don't listen. That's number two. Then if number two doesn't listen, leave him. Let's concentrate still on number one. You go to number three, which is your parents. They made you, but they don't want to listen. Leave them alone and concentrate again on number one. You go to number four, husband don't like it. It's your husband. He doesn't want to listen. He drinks, he's arguing, he doesn't exercise, he doesn't want to have a good life, he doesn't want to have fun. Leave him. I mean, not leave him, leave him. But yeah, I guess you could leave him too, you know. But you know, within the same house, you take care of number one and be laughing, giggling, happy, and have your good friend with you. If number four want to join, that is okay. If doesn't, that's okay. Leave him alone. Are you following me or not? Yes. Because when you listen to somebody, There are only two messages you get from somebody else, either positive or negative. Anything. If the message is positive, listen to it. If the message is negative and you cannot help, don't listen to it. If it is negative and you can help, then listen to it. Are you following me so far or not? So this why when I leave my office, seeing 18, 20 patients, seeing some dying from cancer, some have a stroke, some going to have this, some going to have that, I don't go home crying for anybody. I don't. I go home saying, God, I did my job today. I don't even know if I'm going to be alive tomorrow. And I'm going to have fun from the moment I leave that office until I come back tomorrow. That fun could be going to my farm and ride a horse. That fun visiting a friend who we can have laughing together or something. Or the fun could be have a good night's sleep. Are you following me or not? But food is not part of it. Because by the time I'm done with the day, and I drank so much protein in the morning, and I go home and drink so much protein at night, after half an hour listening to messages, I'm full. So I got to force myself even to keep my weight. So you got to concentrate on number one. When we study memory problems, you can do something about it, like we're going to talk about it, or you can go to a school that teaches about memory. I went to one, but I forgot the name of it. So anyway, you got to do something about it because the brain is an organic part. I had a patient over the phone. Many of my patients, if they do something really serious that I think it's serious, is bad for them, sometimes I argue with them or yell at them. Or I said, how dare you? How dare you do that? And sometimes I don't even know them. I don't charge. I don't even see them. But on the phone, I said, how dare you do that? I had a patient last night. He said, how dare you talk to me like that? And I was quiet for a while. I said, ma'am, I don't even know you. But all I said, what you have done to your health is wrong. And you're going to pay for it. He said, no, I'm not. I'm going to pray. I said, you can pray all you want to. Why don't you pray tomorrow morning when your gas tank is empty to be full and go down the highway? I said, that's different. What different is that she is doing something damaging the heart? What difference? She was doing something damaging the heart. And I said, you could have countered it by doing this and this and this and this nutritionally. But my doctor told me I don't need to do that. I said, but remember, before even you went to surgery, I called you 3 times. And I told you, be careful. When you have the surgery, you must do this because your heart. It's your heart, it's your heart. I'm a cardiologist. I don't have to sit for half an hour explaining anatomy and physiology and pathology of the heart. People have to have a brain to listen. Then, so you gotta learn that we are here just to learn something about the brain and keep it healthy. So the people who have taken care of their brain and they don't have any stress, we showed that in the omega-3 lecture. Is this focused? Yeah. Okay. We showed that in the omega-3 lecture, if you remember. How many people here were in the omega-3 lecture? Raise your hand. It's about 1/3 of the people. We showed that certain population around the world, they live natural life. Some of them are Eskimos. They eat fish, and they don't have the stress, and we study them. We have University of Alaska study them. We do not find Alzheimer. We do not find high blood pressure. We don't find strokes. We don't find this. We don't find cancer. We don't find. So we try to see what are they doing right. So that night we talked about omega-3. But there must be other reason they doing right beside that, which called they don't have electricity, they sleep early, they have good night's sleep, they don't have noise. You know, there's many other factors. So when we talk about brain aging, as this show, brain aging means the brain had a problem. But before I get involved in all this in front of me, believe me, it will be much nicer if I drew pictures so you can understand it, then we can go to that. Most of doctors, they put slides, and you yawn, and you drink your water, you go home. My lectures, we don't do that. We work together during the lecture. The human body is made from organs, and that is the skeleton of the body. Inside this body, there are organs such as the lung that needs oxygen, it needs to work, and need nutrition. The brain tells it what to do. Then we have the stomach, the digestive system, to the colon. The brain tells it what to do. Then we have in the back the kidneys, and the brain tells us what to do. And we have also the heart that pumps blood all over the body, and also, you know, through the vagus nerve and the parasympathetic, the brain tells us what to do, right or wrong? So right here, there is an organ that some people don't have. That organ, what we're going to be talking about today. If we talk about it and successful, then we understand it and we can do something about it. I have to take you through history a little bit that I have studied in Africa, in the tribesmen, how they live, what their memory is. And we find there 0% multiple sclerosis, 0% migraine, and 0% Alzheimer, and 0% ALS, and so on. 0% is the stuff I read. Maybe there is some somebody died in the force, we don't know. I'm talking about the people we studied in universities in Cairo or Khartoum or South Africa, Johannesburg. What to study, we see very little of these problems. We cross the ocean to Brazil and South America, we see the same pattern. We go a little bit to India, we see the same pattern. You follow me or no? We go to China, right here, we see the same pattern. Once we cross to Europe and United States, we see the pattern has changed. Are you following me or no? And the people who defend that, who are medical doctors, say they have worse problem than us, but they don't know. They say they die too young. We don't know. I remember in my village in Egypt, I have walked in the village, and I seen people die at the age of 6 months, and I seen people die at the age they look like 100 or more. We don't keep track of ages because birth dates are not accepted in most of Africa and places like that. People don't go by when you are born, you know, stuff like that. They don't record that. They look old, but they have good memories. They're walking, they're farming. They must be healthy. Some of you from Asia, and you went to the mountain, you see the same pattern. Some of you from India, you see the same pattern. From Mexico, you see that. So they must be doing something right we're not doing. Could it be what they're doing, nutrition is better? Are you following me or not? Could it be they have less stress? Could it be they have less chemicals? And the answer is yes. If we improve nutrition, which I done that to my Shackley patients for the last 30 years, I have only 5 Shackley patients who have the Alzheimer. 5 out of 25,000. Now those 5, 1 died, and 2 we are treating them, and 2 has improved, recovered. Are you following or no? But the rest of them, I know them for whatever. I've been in practice since 1978, and then I communicate with them. They still don't have sign of Alzheimer. We will talk about it later on. So this body, this called the brain, is made of tissue and different organs like this, and the eye will be here. So if the eye here, the nose has to be here. So this brain in front of you is the most valuable faculty you got. It goes bad, you are worth nothing. It's good, you're worth a lot to yourself. The heart is number 1 for dying and living, of course. But you could have a good heart and no brain. What's the quality of life? What is the quality if the heart is pumping and the brain cannot think? So we are here concentrating on number 1. Number 1 is simple. Is made of sections, and those sections specialize in different things. This section here specializes in sensations. Everything you sense, you feel around you. This section back here and behind it, movements. Every part of your body can move. So if this goes wrong, you lose smell, you lose vision, you lose sensation, you got numbness, you got tinglings, you're not feeling, you don't have the feelings you had. If this goes bad, then you have weakness. Weakness of the head and the arm and the legs, whatever, that is coming from the brain, from that section here. But this section right here for balance and vision, and if it goes bad, you can see very well. This section right here for memory, if it goes bad, then you start forgetting things. And there's a section right here with the balance, prevents you from shaking, having Parkinsons, prevents you from having tremor, and that center also important. These organs in front of us, they have cells. So every cell, everybody knows what the cell is here. Anybody doesn't know what the cell is? You raise your hand, I can draw a picture for you if you know. So everybody here knows. Okay, good. So every cell have a function. How many of them? We have 200 billion cells. So there are 200 billion cells right now keeping you alert, alive, awake, thinking, every 200 billion. Even if you have a stroke and lose 1 million, you still have 200 billion almost there. Just to make it easy on you, even if you have migraine attacks, when every migraine attacks you lose around 500,000 cells, you have plenty left by the time you're 100. Now, I said 200 billion, right? each one of them, each one cell, this is one cell, it's connecting like this through the body, like that, with wires. Each cell has 10,000 garden cells around it to clean it. 10,000 servants around it. You follow me? 200 billion and you got 10,000 servant. Means you could have a stroke, but don't worry about it. The 10,000 will take care of the rest. Are you following me or no? You have a mess, don't worry about it. The 10,000 will take care of that. That's what they're there for. They're there to scavengers, to get rid of things, add things, do this, like that, and they use nutrition to do their job. So to do that, there is also myelin sheath. Covers each nerve right here, which protect it from touching each other so you don't have seizures. That myelin sheath also made of nutrients. I wish I would have the time to talk to you about every single nutrient to revive the brain. In details I am talking about. I wish I had the time. Because I'm a lucky person. Once a week, I'm in the plane for 8 hours. Every single week, I'm in the plane for 8 hours. 4 hours to California, 4 hours coming back. And all I do on the plane for 8 hours is read about nutrition. And the more I read, the more I want to tell people. But the time is limited. So these copies right here, lots of it about what you take every day, supplements. I have about 5 pages on multivitamin, Vitalia alone. I can speak about it for maybe 5 hours. Lecithin reminded me by that. I have 2 pages on that. And I could speak out for 1 hour. So we don't have the time, so let us get to the point right away so we don't walk out of here more ignorant than we came in. So this material here is made of lecithin. And lecithin is a substance that protects the brain. We're going to go through some of the, all the stuff I was going to show you was my handwriting. When I was trying to read my own handwriting, I had difficulties. I'm going to show it to you anyway. Then I decided to use somebody else's handwriting. But it's not as good because it's not complete. So it says brain aging. It could be, oh boy, this is not focused. Okay, let me just focus that a little bit. Okay, that's better, right? Okay, it can be from, it can be the damage to the brain from free radicals. I'm going to talk about that. It can be deficiency of vitamins like B12. It can be decreased level of hormones like estrogen, testosterone, DHA, or something like that, thyroid. It can be reduced oxygen from blocked circulation. There's not enough blood going through. It can be the neurons itself. The cell itself is covered with sludge, like a metabolic syndrome, syndrome X, homocysteine, LDL. All this covers the cell, and the cell cannot get anything through to the mitochondria. You know what's a mitochondria? You heard it, right? What is the main function of the mitochondria? Simple, produces energy. So if the food cannot go inside the brain cell to produce energy, then we're going to have mitochondrial malfunction, means fatigue of the brain. And then we might have decreased neurotransmitters. I'm going to show you some neurotransmitters today from the diet you eat. I'm going to show you some example. It could be deficiency of nutrients, magnesium, manganese, lecithin, taurine, tyrosine, phenylalanine, whatever that the body needs, it could be deficiency of that. Which doctor you can go to will analyze your brain, to find deficiency in it. Nobody can, because you have to do biopsy of the brain. So we can do red blood cell analysis. We can take red blood cells and white blood cells and break it down. It's not accurate testing because the brain is accurate, but the test itself will run in thousands of dollars and Medicare will not cover it. So let us just use common sense, use the brain to think. It could be also hyperactivity induced by glutamate toxicity, like chemicals that you ate, like MSG or NutraSweet or chemical you might have consumed. You follow me or no? It could be metabolic disorder such as thyroid problem, anemia, adrenal problem. It could be depression caused by methylation deficit, such as homocysteine increase and that. So in those patients who have that, we use a process called methylation, that we remove the sludge from their body. It's like chelation, and so they can think more clearly and have more energy. So sometimes also the brain attack itself. And when the body attack itself, let us forget about the rest of the body, just concentrate on the brain. We'll bring it down here, so right there. Then if it attacks the brain, then we have brain problems. MS, Alzheimer, all these things. If there is something called autoimmune disease. It could be also, I don't have those in orders, but I'm going to just pick them as they come. It could be nutrients, like soy protein from Shaklee. People say soy protein is not good for you, can cause cancer of the breast. And you got 2 billion Asians using it, and they don't have cancer of the breast. Tyrosine, one of the amino acids that we get from protein. That's one amino acid. I'm giving you examples. Everybody, just an example, so you leave with an idea that nutrition can reverse problems. Are you following me or no? I'm not here to tell you take Aricept. I'm not here to tell you take interferon for MS. I'm not here to tell you take L-DOPA for Parkinson. This is not the reason of that lecture. The reason of that lecture, what disease? What can we do about us nutritionally? This is tyrosine. Did you read it, what it says already? It says it's important for brain function, and it's a precursor. You know what the precursor means? A precursor of neurotransmitter noradrenaline. What does noradrenaline do? Give you what? Adrenaline, energy, right? The heart works out and the rest of the body. If you don't have enough, then you have a sluggish bowel, sluggish heart, sluggish body. You need an adrenaline. And also secretes what? Makes what? Dopamine. The word dopamine came from dope. The word dope that we invented in the hippie days, that we must take dope, came from the word dopamine. Because when they took dopamine, they feel good. Dopamine, you can get it in many forms. Cigarettes have dopamine, nicotine dopamine, caffeine is dopamine, cocaine is dopamine. You know, so if you want to consume outside dopamine as a drug, you will feel good. But the end result will be what? Death, that's right. Because you're not supposed to inhibit your brain from making dopamine. If I give you dopamine, your brain will stop making dopamine. Right or wrong? If I give you adrenaline, your brain will stop making adrenaline. If I give you thyroid, your brain stop making thyroid, because what for? So the idea is not to challenge the brain to give drugs like Paxil and Prozac and all the stuff. The idea is to help the brain. And I just want to show you dopamine, which regulates mood. L-tyrosine support mood and help to suppress appetite and promote stress relief. So that's one of the function of one nutrient. Another nutrient, glutamine, that you get from red meat only. You only can get from red meat. The only source for it is red meat. So here I am going to break through the people in this area who said, I will never touch red meat the rest of my life. I tell them, good. Let us see if your memory will last. Are you following me or not? I have people who tell me that. We don't want to be fanatics. We want to be knowledgeable people that we can walk in toxic place like McDonald's and come out alive. So you cannot tell the grandkids that they want to go play and they want to have a good time with mommy or daddy. No, we're not going to go to this toxic place. You're going to be smart and say, there are good food and bad food in this place. We're going to go inside, look at the menu, and we're going to look for the best we can, but we're not going to make a habit of it to do it all the time. So the kids don't grow with psychological thing, they run behind your back and go there. Are you following me or not? Glutamine comes from meat. Meat can be good meat or bad meat. Organic beef, non-organic beef. Or it can be from deers or can be organic deer. Deer is good. So what I'm saying, what does glutamine do? Glutamine cleanses the nerve pathway. The nerve pathway is a tube like this from the brain to the leg to tell you when you touch hot plate, take your hand off. And if the pathway is not clean, you put your hand and you burn it, and you say, I wonder what happened to my hand. Because that happens in a disease called diabetes, right? They walk in, they have problem with circulation of the legs, and they walk on hot plates, and they don't know. Right or wrong? Some of you took care of diabetes. Because the pathway is not clean. Glutamine cleans that. You don't even have to go to Dr. Nasr to get a chelation or methylation to clean it. But you got to eat organic beef. Glutamine cleanses the nerve pathway so you can think better, consider to be energizer of your brain. It's also stop craving for sugar and alcohol. So this is published material, by the way. Talk about potassium. In previous lecture, you guys, if you want to come back to future lecture, then you better register ahead because we're not going to be notifying everybody every time. The mail is expensive. But I want to talk about potassium because Shaklee produced potassium right now called potassium magnesium. Potassium, I already told you in previous lecture that we need tons of it. Lots of it. And it's right here to show you, it is right here to show you that you're lucky to get 30 kilo equivalent of potassium a day, and your requirement is close to 5,000. But all I'm asking my patient is to take 180. That's all, and we see results. What does potassium do? This mineral contribute to heart muscle health, promote healing. Potassium can also be used to help reduce stress and help with blood sugar, and also enhance muscle and nerve cell function. So I'm giving you example of little things every day that you don't do. Adrenal hormone, DHEA. What does it do? We have many articles on DHEA. We don't have time to show it. Over time, your natural production of DHEA goes down. By that age, 25 years, you start going downhill because the stress affected. And when we give that natural DHA, we find out the person start getting younger. One of the newest one. You know, vinpocetine used in Europe for memory loss. Widely used in Europe and South America to boost mental energy. Vinpocetine also play a role in supporting cerebral circulation, cognitive function, and balance, and good for against Parkinson's disease and migraine headaches. This all going to be on the DVD, so you have to buy them. So, melatonin, an herb. Be careful with it. Of course, it's a drug now. Natural drug. What does it do? It helps with the sleep, with relaxation. So, another substance we have to be careful called homocysteine. And all my patients here know that we find high homocysteine in every single patient. No exception, include me. Perfect is 4. Mine was 22 as a doctor. Now it's down to 9, but it's not 4. And we take B12, folic acid, B complex, TMGs. We're trying because I'm the only doctor, I should say the only doctor, I'm one of the very few doctors in the country who are board certified in holistic medicine. Last time I told you I'm taking the board, I passed the board. And during the board, the 150 of us in the country, which we know each other now, we can refer to each other in Madison, here. We have surgeons we can refer to. We have neurologists we can refer to. We have gynecologists we can refer to. We're no longer in the dark like we used to be. So on those 150 doctors, we teach each other. And the homocysteine implicated in causes what? Dementia. And I'm sure you know how by now, because we already talked about it. Blood pressure, we call it what? We call it the silent killer. What is the biggest mistake we make with blood pressure? We like it when it is low. And when it is high, we say it's a white coat syndrome, it's stress related, it's a doctor doing it. You know what? You got to have a brain to think also. You only develop strokes during when it is high, not when it is low. So which one I should be concerned about? When it is high or low? High. So for that reason, we have to be sure that our patient blood pressure will go the highest when they are having consultation with me. I got to tell them, you got this problem, this problem, this problem, this problem, this problem, this problem, and we take the blood pressure and it shows high. And that's good. This is your blood pressure. It's going to come down later, but this is not what I want you to do. When the grandkids make you mad and you have financial problem and you have this, your blood pressure also going to go up. That is the moment a blood vessel will break. Because the human body has 1 million miles of arteries. And it can blow up any place. You follow me or no? Diastolic maximum, we like it, is 80. We can accept 100, but we definitely don't want to accept 110 because it blows up at 120. And it can blow in the eye, go blind like my brother did. Can blow in the brain, cause a stroke. Can blow in the kidney. Whatever it wants to blow, gonna blow. And a good example of that, you hit yourself, you have a bruise. What is a bruise? It's a blood that blew up. How can, when you were a kid, banging every place, you never have bruises, right? You have some, but not a lot. But when we get old, why so many bruises? Because the cells themselves are becoming weak, fragile, inelastic. Then the brain also is doing the same. So high blood pressure is a concern. And Actually, this here, just to tell you, in my board, we have our own books. We have our own doctors, our own neurologists, our own doctors, and we have our own books on cardiology and neurology and obstetric, rheumatology, you name it, we have our own books that treats conventionally and nutritionally, both. So we have. So this chapter 5 from one of our books that was talking about what can we do about this stuff. And this is about tension headache, and we're not going to cover that. But I want to bring my handwriting here because that is really the highlight of the whole lecture anyway. And I can find that when I was driving right here, I wrote a note. I said, and in that note I said to myself, I better find it and then put it in the screen and then tell them a joke. And then I found it. The goal of the body the goal of the person is to be healthy like this before we put the brain again Alzheimer. Healthy body, healthy mind, that's very good. I have somebody from a Catholic church send me a joke because my patients always send me jokes. I tell them, if you don't have a joke, go home. So everyone comes with a joke. So we sit down and laugh first, then we start the consultation. And the joke was like this. 4 mothers, after Sunday Mass, they sat in a restaurant. You probably know it already anyway. And they said, the first one, she said, I'm so proud of my son. When he walks in the church, everybody call him a father. I'm so proud. And the second one, my son is better than that. He's a bishop. And every time he walks in, he says something else more important. And the third one, he says, a cardinal. And if time he walks, they said, your eminence is all of this. But the fourth one said, no, my son is 6'2", and he's a bodybuilder, and he's a stripper. And every time he walks in the church, they say, oh, God. So they elevated him above Father and God. And I said, to God, So I told that to my patient over there, and he liked it. So anyway. So dementia, or loss of memory, I wrote it down the best I can on the aeroplane, of course. So if you cannot read it, it's the turbulence. It's not me. You can see there is early symptoms. You can tell there is something going to go wrong with memory, such as recent memory loss, that you just had breakfast and you don't remember you had it. You put the keys someplace you don't remember, and you keep repeating the same mistake. The recent memory is going away. We all have recent memory problem, but if it's continuing becoming a pattern, that's a warning sign. Second, forgetfulness, which is related to everything, forgetting everything. That's the beginning, by the way. Disorientation. Gee, where I am. I don't remember this area. Would you been there before? I wonder where is Kmart or Home Depot, this way or this way. I know I've been here twice. That is a warning sign. Confusion. You can think straight. Mood swings. One time you're so happy, another time you're so sad. That's a sign, could be sign of dementia, because right here on the bottom I say differential diagnosis. What other diseases can cause that? So we are still right here. And language problem, the slurred speech or the language not clear. And depression also can be a beginning of dementia. You see that mostly in what? If you had a friend who had a stroke, after the stroke, they develop depression. Did you notice that or no? Have you ever known depression? And depression, most of the time, can lead to Alzheimer or dementia unless you catch it yourself and start correcting it with crossword puzzles and nutrition and all the stuff we're going to talk about. Later in life, when you know it is getting advanced in Parkinson lead to Alzheimer, by the way, and they're all related, interrelated diseases, and migraine lead to both, by the way, so that's not good news for women. Later, there is motor disturbance. The hand starts shaking, the handwriting is still scribbling is not right. Tremor start occurring. Incontinence of urine start losing control. Hallucination, the same thing doesn't make sense. And then schizophrenia, that the person is becoming paranoid. That telling their friends, you are here to steal my money, my daughter stole this, paranoid. You know, you're not trusting anybody. Everybody is about to get you. You know, and that paranoid schizophrenia is a sign of dementia. And then inability to make daily activity. The person used to make the bed, go to take a shower, used to do certain things, hygiene and all that, start neglecting themselves. And they don't take in a shower. They just don't want to change the clothes. They want to sit in the same chair. They don't want to do things different. And what we have done to those people, besides nutrition, very simple. I'm going to tell you that because maybe we don't have the time in the end of the lecture. I told all the patients, I discovered that when I'm experimenting on a weight loss program, an exercise program using Shaklee. So what we have done, we have developed some diet that uses protein and alfalfa together as the major supplements. And so far, it's working in some people, not working in others, but it did work, you know, in lots of people. One of the things we have suggested that the people should take hot bath at night, about 3 hours before they go to bed. Taking bath at night and doing a little bit of sit-ups, even in the bathroom. You know, you close the door, do some sit-ups, 25 sit-ups, you know, if the bathroom big enough. If it's not next to the bedroom, do some sit-up, move muscles, you know, joints. Go sit in the bathtub half an hour, or do it first and do the sit-ups afterward. But you go to sleep clean, and you have more circulation, and you have less backache, and you have less spasm, and you feel good. But that's not what we do. What we do now is we take a shower even in the morning. There is a difference between a shower and a bath. A bath with lavender or with aromatherapy or go to sleep with some lavender candles, it has effect on the body. It has calming effect on the body. So remember that. Now we'll continue. During autopsy, we discover something on the patient who have Parkinsons and Alzheimer. They have amyloid plaques. There is plaques on the cells of the brain. The cells of the brain, if I can find the brain, was here a few minutes ago. Right here it is. The brain, it looks like this. The brain starts having sludge buildup around the cells. You see the black stuff right here? That sludge called amyloid, homocysteine. And when that develops, this leads to a problem called amyloid deposits. So I'm going to show a picture of it in a minute. And then the fiber themselves, they tangled. Right here. We look at those fibers, the 200 billion, they tangle like this with each other. But this is during autopsy. So we find the brain to be getting smaller. When patients come to us with with memory problem, migraine, we do what we call MRI scan, CAT scan of the brain. We see the brain starts shrinking in size. So what we have done here, what happened to the other one? Yeah, right here it is. We have to differentiate between Alzheimer and strokes, or blocked carotid arteries, or pernicious anemia, or Parkinson, or drugs. Some people take drugs and that cause problem. Some people have too much environmental toxins in their air, water, and food. They don't have Alzheimer, but the toxins make them feel like they have Alzheimer. They can think because there's something in the environment is blocking the pathways. Are you following me so far or no? There may be nutritional deficiency, maybe alcohol, maybe depression. So all of these things are factors that lead to that. So we will skip through some of these things to come to what can we do to a Parkinson patient or Alzheimer patient. The first thing we're going to talk about is conventional. We can give Aricept, we can give L-Dopa, we can give drugs, and I do have one patient on drugs, but with nutrition. But nutritionally, we can do so much. Vitamin C, vitamin E, beta-carotene, B-complex, calcium, magnesium, potassium, zinc, manganese, and selenium, and in the DVD right there, they do help against dementia. Exercise help against dementia. Biofeedback. If you don't know how to do biofeedback, just know that meditation and prayers to God is biofeedback, by the way. That it is. And then we also use hypnosis. We use massage therapy. Acupuncture can help. Aromatherapy can help. Manual therapy with chiropractor adjustments also can help. Reflexology can help. So there is a lot of things can be done to help that patient, and then we must concentrate on those things. Some of the stuff I already covered, and then we're going to put other causes of memory problem, brain problem. You can see in this page, I have numbers 85, 86, 87, 88. You see those numbers, right? This basically the papers being published to prove the point that I have papers and numbers. So none of the stuff we're saying is from the National Enquirer. None of the stuff is saying is ignorant. 99.9999% of the books written in the markets is trash. Is garbage. It's done to sell the book. And 99.9% of the therapists, they intended well, but they're ignorant about what they say. Because you only see what you know. But if you don't know, you don't see. Are you following me or not? So if I have a problem in my car, I don't open the engine, I don't check nothing. I drive it to the mechanic and I tell him, you check that car for me. You the one who knows, not me. You follow me or not? Yep. So when somebody come and tell you, oh, your problem, you could correct it by taking this, taking kava, taking mao, take this, take that, don't believe it. The worst thing you can do to yourself, to be gullible. I'm going to show you an example of people who are gullible. The reason I say that, specifically for one person that's going to get the DVD, that I want him to hear that. A gullible person is a person that deny that they have a problem and they want to solve it only through their own way. They will say, I know I can pray and get better. And if I fail, I will get 10 people to pray for me. And if I fail, I will get 1,000. Believe me, prayers work only if you do your share. And if you don't, you deserve not to be better. Because you're doing it to yourself. This body you have is not yours. It belonged to God. He trusted you in a body that you are trustee to take care of it. And if you're not taking care of it, you're not taking care of it, and you drink alcohol, you're not taking vitamins, you're not exercising, you're not doing the hormone, you're not doing, and you're praying, I think you're just making up stories that you want to convince yourself, but you are getting old. You will develop Alzheimer, and you'll be sorry. But by that time, you're not sorry because you don't remember you're sorry. So in any case, let us talk about nutrition. What's been published? It's been published, number one, that free radical increases Alzheimer by 200%. Number two, stress increases Alzheimer. Number three, article number 88, deficiency of vitamin B1 and B6 and B12 and folic acid and magnesium and zinc and selenium and B3. I'm only mentioning this was published in paper number 88. In paper number 89, published the deficiency of E and C and beta carotene can lead to memory brain problems. Paper number 90, published omega-3, says that can lead to memory loss. Patient 91, it says MSG and NutraSweet can lead to problem with the brain. Toxicity. Aluminum and mercury was found at autopsy. Some of you think that aluminum and mercury and lead, which are heavy metals, you can get rid of it by having colonics, colon cleansing. I want you, some of you, to have a little brain and think with me, why do we call them heavy metals? Because they are heavy. Where do heavy metals go to? They go to the fat in the brain and the liver and the heart and then. You think that cleaning the colon is going to clean the brain? No. What do we do in life if we have a piece of aluminum or mercury? How do we leach it out? How do we extract gold? When we do gold and have contaminant, how we do? We mix mercury with it, right? To extract gold. Remember the old days. Because heavy metals need something else to take it out. You follow me or no? It could be chelation, intravenous only, not by a suppository or orally, or it could be medication, but some vitamins also, they do chelate certain things from the body. So heavy metals are dangerous, and we all have it in our brain. Mercury can cause nerve damage. Drugs that can cause problems. Lots of drugs can cause memory loss. And we already talked about other diseases. Inflammation, fibromyalgia, arthritis, pain in the muscles can ruin the brain. Because when you are in pain, the brain doesn't rest. When the brain doesn't rest, it gets exhausted. When the brain gets exhausted, you have next day empty body, fatigue. You follow me or no? So one of the main goals we do with patients, good night's sleep, get rid of the pain. We start with good nutrition. If it doesn't work, we give medications. And the final goal is good night's sleep completely, and the next day feeling good. And that's what happened when we apply nutrition. There are different books say different things, and I wanted to skip through that because we will be wasting lots of things. But I want to just put this article here because it's so important. Some of it related to Alzheimer or MS or Parkinson, but lots of it related to other diseases. Inflammation can lead to Alzheimer, allergy, anemia, valve disease, arthritis, cancer, heart failure, diabetes, fibromyalgia, fibrosis, myocardial infarction, kidney failure, lupus, pancreatitis, psoriasis, strokes, and surgical complications. All of this done so fast. That's how we like to talk, is fast. I wanted to show you, when I told you earlier that potassium, I just found it now because I was sitting outside trying to organize it, and then I couldn't. So I had to make a prayer. Maybe God will help me. He did, I guess. Look how much potassium we consume per day, 150 milliequivalents. How much they consumed our ancestor, 10,000. So the idea of potassium, you have to pay. Another thing I want to warn every one of you about, salt. Salt is good for you. Salt doesn't hurt you. Salt does not cause high blood pressure unless you have kidney failure. Butter does not clog your arteries unless you're 300 pounds. So I want you to know that milk and butter and salt are not your enemies. Be sure that if you feel that you need some salt, put some salt. Eat a pickle. Or do something like that. If you feel like it, you need it. Have you ever seen kids eat clay? They eat clay because they have deficiency of magnesium and manganese and selenium, and the clay habit. So kids eat clay. See how God programmed even kids to find something to get themselves better. We are a society that is suffering from many things that lead to brain disorder. Number one is genetic problem, that we are born with problems we need to get rid of, some of it through nutrition. Number two, nutritionally, we must pay attention to the soy protein and meat, good quality, and fish, fat, olive oil or any other oil, carbohydrate, don't forget whole grain bread, vitamins, don't forget all your supplements. And if we talked about supplements, then we have right here, as long as we did that, there was supposed to be the last part of the lecture, but let me put it here to become now number one in the lecture. Here are the food supplements that I put on the screen to show you how important they are. I make this lab right here, and it's available for everybody who want to call and get a copy. It says protein, the protein, Vitalia, and all these things, and ages. And it tells you 0 if you're not supposed to use it. It tells you 0 to 1. It tells you 1 to 2. It tells you more and more, and you can get it from my office. You follow me or no? This has A, the important ones, and B is the second important ones. So you can get that from the office, and it's the phone number is up there. It will be on the screen. Well, this is one page, and there are 2 pages. The second page of the supplement, which covers the Aptoflora, and it's the same one? Oh, they made a copy of the same thing. I told her to make both sides, but I guess she made a copy of the same side. So we're missing a side. You get it in the mail then. So now we are suffering from lack of vitamins, lack of minerals, lack of fibers, lack of water. Oh, I'm writing on the screen. We run out of paper here, you know. Let's go next to it. Mineral. Okay, fibers and water. Sorry about that. Okay, and water, all of this we need to consider. How much water we're supposed to drink? You already know, right? How much? Huh? A gallon, no.
2/3 of your weight.
No, more than, huh?
2/3 of your weight.
2/3 of your body weight in ounces. Okay? Half to 2/3 of your body weight in ounces. Half to 2/3 of your body. So you weigh yourself in ounces, in pounds, whatever. See how many ounces. Take half of that body weight, convert to ounce. That's how many ounces you need. Minimum is half, maximum 2/3. So if somebody's so big, he needs more water than somebody so little. You understand or no? So it's not 8 glasses or a gallon or this. It depends. And water also is not beer. And water is not juices. Juices are not water, it's sugar. That's when you drink lots of juices, you need more water because you have too much sugar. Coffee is good if it's black, or it has very little sugar in it. That's a good source, as long as you use it as a stimulant. You use it in the morning because your body needs it. You use it at noon because you need it. And I'd rather have a coffee with meal than a beer with meal. I'd rather be awake and laughing with my friend than be drunk. So tea is excellent, of course. Green tea is the best. Cinnamon tea is great. Black tea is not bad. But cinnamon tea, you can go to Whole Food, and then you can buy the cinnamon sticks from Hawaii or from Africa. You get about 14 sticks, and you put it in a pot of water. You fill it. You put it and simmer for about half an hour. Bring it to boil and simmer it. And then once you start smelling it, you shut off because you're losing the aroma. And you take that and mix it with green tea. You can buy some green tea. You mix some honey with it, and that's a good drink. It has lots of epiglottic acid in it. If you have green tea, cinnamon, of course, it helps you with weight loss. It helps you with energy because it's anti-diabetic. It gives you lots of sugar in the brain. So this is the summary of the supplement here. The summary of the stress causing brain damage. You can take care of that with sleep, with meditation, with exercise, with you can have stress relief tablets, you can have valerian, you can have mood lift, you can have all of that, you can have calcium, you can have magnesium, you can have potassium. Try all the natural first and exercise. When it doesn't work because you do have really, really severe stress from your kids, grandkids, whatever, then medication might be indicated. Here is toxicity. Causes also brain problem. What kind of toxicity? Water, food, and air. Let us look at the air we breathe and the food we eat. This is a picture released by nuclear energy emission from United States, nuclear energy commission, to tell us the nuclear fallout in the United States 10 years ago. And the safe part is the blue, and the yellow is dangerous, and the red extremely dangerous. This is released by them. This is how much fallout. And you can see yellow is moderate. The word moderate is too much, right? If I give you radiation and tell you this is moderate amount, don't worry. Would you worry or not? If I give you radiation and said that's very little, you trust me more. But if I'm giving you moderate amount, you better not trust me. That's a lot of radiation. And that radiation came from two sources. One, when the nuclear bomb was developed, was above ground. So all the experimentation in Russia and the United States was above ground, and China. So the jet stream carries uranium all the time. What is the half-life of uranium? And plutonium, what's the half-life? 4 billion years. So we don't have to worry about Iraq. We don't have to worry about Iran. We don't have to worry about China. We are doing moderate job of bombarding ourselves. So when somebody say that about this country, I start laughing because you cannot be a wolf with sheep skin and talk. And politicians are wolves with sheep skin, and they say what they want. And I don't trust them. You know, I wanted to show you another one from them, not me, from them. In my practice, we have lots of thyroid cancer. We detect thyroid cancer more than ever right now. So this is why most of you, my patients, remind me to give you potassium iodide to block the cancer from going to the thyroid. Thyroid cancer is spreading very rapidly, and here is the thyroid cancer around the country, and then the darker the areas you see, the more cancer of the thyroid we see. The darker, the more cancer. So you see the whole country is in danger. And the reason behind it, in New Mexico, the explosion was 1939, right? They didn't know jet stream exists. So jet stream went like this and goes around the world and changes pattern, right? And then that's why we saw most of the cancer in Colorado, Illinois, and then we start saying to the government, is something you did in New Mexico could be causing this cancer? That's 1945 they said that. Absolutely not. Everything we did absolutely safe. And whenever a politician says absolutely, then you better be careful. And you know, you have good senators around the Congress, around Senate. You have good congressmen. Find a good one that care more about America, health issues, and support them. Not war issues, not industrial issues, not gun issues, not weapon issues, just health issues. And that's the person. Tell him, I'm supporting you only if you support my environment and my health, my food supplement, I support you. I don't care if you're a Republican or Democrat or wherever you are, I'm going to support you. If you're not going to get my vote. Are you following me or no? Because remember, America is the last place on this earth with freedom in it. And maybe God wanted that way. But if we destroy the last place, there's no other place left. And it is going downhill very rapidly. This is how many chemicals the industry releases emission in our air, which is thousands and thousands of tons of reactive oxygen species, ROS. You know what that means, right? Free radicals. That is all the stuff right here and right that causes cancer and Alzheimer. And we have non-radical exist in the environment, and we have all kinds, but we have also ways to go around it. Flame retardant in mother milk. This was published in Thursday, September 2nd, 2004, USA Today. What does it say? It says 100% of mother milk in America have flame retardants, PCB. Do you think PCB is good for the brain? So 100% of kids on mother milk have taken PCB. But we encourage mother milk. How can we counter flame retardant? Very easy. Vitamin C and omega-3 and supplements with her milk, when she takes it, removes the flame retardant from the milk she's going to give to the baby. You understand or not? So the only people might survive in this country may be you people, the Shaklee people. And the rest will be in nursing homes so we can serve them. You know what? Listen, this is something really. I'm an immigrant. I came to this country by immigration. The government invited me to come here because I applied. But I'm not anti illegal aliens. I'm not anti. As long as they obey the law, they're productive, they pay their taxes, that's fine. However, I'm going to tell you something what will happen. The way we are going, they probably the only people going to serve you in nursing home when you have Alzheimer's. So let us not concentrate on hate issues, which we can't control. I'm not a border man. I don't allow men. I am going to love everybody walk in my clinic, regardless of their color, race, sex, or religion. You follow me or no? I will treat them. I will never ask a patient, do you have insurance? Or are you black? Are you white? Are you Spanish? Are you legal? It's not my job. My job is to listen, tell them this is your diet, this is your program, and good luck. And that's how we should practice. Even I am for anybody want to come should really go by the law, apply and go through that and that, because our population is going down. Our people don't want to work. Our dirty jobs, nobody want to touch it. Look at Europe, England, Sweden. Their population going down minus 2% every year. Who is going to clean their street? They import in Africans from north of Africa, because nobody there want to do it. There's nobody to do it. We are one earth, one Adam, one Eve, one God, one earth, and we should get along with each other, and there is plenty of resources all over the world to feed everybody. Are you following me or no? Plenty. And then we have to think about that. I want to show you this picture right here. It's hour and a half already. We're talking almost, but I just want to put that to the people who are scientists in this room, that when the nucleus of the brain, DNA and RNA, get bombarded by drugs and radiation and all these things right here, on the left and the right side, antioxidants protect the brain. When the brain having memory problems, it means there is not enough antioxidant, and the DNA got what? Mutated. You know what mutated means, right? Okay, that is DNA in a state of mutation. Means the DNA is multiplying in the wrong way. Okay? Now, and this can lead to many diseases in the brain. But right here, I'm going to show you this one. Here, it says in the article by American College of Physicians, 1996, however, even we have a problem with our Alzheimer's, memory and all of that, look at this. However, there are repair systems, repair enzymes in your brain. They're not perfect, but they cure 99% of the lesions. They remove 99% of the brain lesions. And the brain lesions, they look like this. The first of all, I want to tell you, if you look at this heart scan right here, you would look at it and say, gosh, this person's arteries look so perfect. He had no problem. This has happened to be mine. So when we magnified it, we find small plaques, tiny bit in it. Starting, then I did something about it. The stress test told me I'm in perfect shape just a day before the test was done. The blood test you should do for the brain, it should be the fibrinogen, the C-reactive protein, the homocysteine, the sugar, the iron, the cholesterol, the LDL, HDL, triglyceride, DHA, hormone DHA. I wanted to skip through fast to show you these are the arteries going through your body, and these arteries from 33 years old, and this is from somebody, I don't know the age, they have plaques inside it going inside their body. Eventually, they had a complete blockage and they died. And some of them have more blockage than the others. And this ones, if we want to look at the age, this will be 47 years old man. Now, if we look at the body inside, I'm going to have to ignore some of these things here, put them aside. If we look at the body inside, what it looks like, the brain, here is what the brain starts looking like when you start having problem. What do you see on that brain?
Dark spots.
You see dark spots. Exactly. I want you to pay attention to that. Something doesn't look right, like bruising, right? And then when we look at the skin of that person, we also see what? Age spots. You see that? Then when we look inside the brain of the people who have age spots, we look inside the brain, we find what? Slime in the brain. Is that healthy or no? And when we make it larger, that's what it looks like. Age spots on your skin might indicate the same thing in the brain. So I am going to skip through some of these things right here to show you that some hormones that you are missing might help you with your memory, like DHEA. DHEA is good against inflammation, immune dysfunction, depression, rheumatoid arthritis, diabetes, cancer, and cognitive decline right here. So DHEA is a hormone, should be measured, and we should replace it with natural DHEA, which is very important. DHEA also does other things for multiple sclerosis patients and Parkinsons. Read what it says. It's going to be on the DVD, but read more about it. Increases IGF-1 by 20%. That is the hormone that keeps you young. Increases monocytes by 35%. That's cells that eat mononucleosis, viruses. Increases the B cells by 62%. 29 and 62, you have to read through it. The number is 29, activity 62. Means healthier cells, 62, and that's the cell that fight cancer. Increases the T cells by 40%, that fights bacteria and lymphoma. Increases interferon by 50%, and MS patients take interferon, right? Increases killer cells by 37%, 45% effectiveness against pneumonia and colds and flus and avian flu and chicken flu, all this stuff. You don't have to worry about it if you have enough DHA, and it has no adverse effects. So that is, now I will skip through some of these, but I just want to put a summary on the screen about omega-3, summary for all of you who heard it. Just don't have to look at it, but omega-3 does all of these things that we have on the screen. And also omega-3 does reduce triglycerides. Omega-3 helps the heart and circulation. We're going to talk about it next lecture. It's against metabolic syndrome X, against high blood pressure. I'm coming to the important one. And against inflammation. What is the last one? Okay. Against whatever. Against mood disorder. Against vision problem. But the last one, how come is the last? Here it is. That for the mothers who breastfeed their babies and pregnant, if they take omega-3, the brain is made of 70% omega-3. And the eye, 80%. And the body is 60%. So the more omega-3 she's getting when she's pregnant, the healthier the baby, the better the brain. The IQ for children who had taken omega-3 up to age of 3 increased by 30%. Now, the last thing right here I wanted to mention, this one also may be important, that DHA also was proven to be anti-brain aging. That's in another research. Here is a nice picture about estrogen hormone. People say estrogen is not good for you. Yeah, they are right. There's 500 estrogen women have in their body. Only 3 good ones, and 497 cause cancer from herbicides and pesticides. So our job is to encourage the consumption of the good and less of the bad. Are you following me or no? You get the good from soy protein. You get it from, we make ours from Mexican wild yams. But here's a picture of a brain in this side right here have lack of estrogen, and here is the white has plenty of it. So the memory is a white, lack of memory is black. And the estrogen did that. Now, this is the nicest picture of all for all of you, and I'm glad we have time to put it on the screen, how the brain keeps itself fit. This guy here, which you cannot see, from University of Southern California, which I don't like them because I'm a UCLA fan, but anyway, I put it on the screen. And this woman right here, we cannot see her, maybe because she's dead. Now, she developed Alzheimer's. And Dr. Hendrickson was treating her with, let's see, what did he treat her? With hormones. He gave her progesterone, natural, testosterone, and estrogen, and growth hormone. And her memory was improving. And she got in a car accident. And she died. They did autopsy, they find the following. The nerves, the dead nerves here, that's called Alzheimer, she had 4 of new ones developed next to it. She was in her way of rejuvenating her brain. We have a patient right now had Alzheimer 20 years ago. Her name is Wilma Swanson from Zion, Illinois. Some of you may know her. I don't know if you know her or not. She's 92, 93 right now. And she drives every month to get her treatment. And she say, you know, those kids in the road, they drive too slow. And she had full-blown Alzheimer 1981. And now she have nothing, none of it. So I wanted to tell you that this is a problem we noticed in women. They have more Alzheimer and they have more brain disease than men. And we find out this study behind you, 200,000 women were involved in it. We found out if you have the good amount of good estrogen, not the bad one, you will have less Alzheimer, less mood problem, less depression, less eye problem, less macular degeneration, less mood problem, less sleep problem, less cholesterol, less heart attack, and less death, less colon problem, less urine problem, less bone problem. So you can name the estrogen as anti-aging hormone if it was the natural one. So we know the majority of women spend half of their life without hormones, then we have to pay attention to that. This probably gonna getting close to the very end, and there is nothing else I can say. Whatever I didn't say, I will cover it in the next lecture on what's gonna be circulation, I think, right? Oh, I want to show you this one here. I put it on the side for a reason. Acuity. This is what acuity does inside the body. This is one of the research I've been doing. Acuity, it's a vasodilator. It decreases blood pressure. It reduces edema in the eye. It reduces glaucoma, reduces seizures, reduces Alzheimer, migraine, Parkinsons, brain tumor, reduces ringing of the ear, reduces liver disease, liver cirrhosis, pulmonary hypertension, heart failure, pancreatitis, phlebitis, kidney problem, reducing cellular damage and blood pressure. That's just one function of acuity. Second one, right here, is it's MAO inhibitor, so it increases energy, decreases depression, decreases Alzheimer, because it inhibits the steroid production. It has neurotransmitters in it. So that is there's more benefit in it. We don't have the time because I'm going to give you my phone number, and my phone number is 847-571-3914. That's my cellular number. And the office is 847-356-9009. That's my office. Now we're going to take some questions for the next 10 minutes because we have to get to our cars, which is going to take us a couple hours. And then I have to drive a couple hours to my house. Then I have to catch a plane at go to the airport at 3 o'clock in the morning to take my family to London to see my wife to see her family there, which I haven't seen them for a while. So I decided to do tomorrow morning. So I'm going to take some questions, and if I don't take everybody, I apologize. Yes?
Yes, I've always wanted to know what's the difference between Alzheimer's and dementia.
What's the difference between Alzheimer and dementia? Dementia is the beginning of Alzheimer. Any other question? Yes, sir.
Could you clarify, there's been a statement about leaching or getting metals off the brain.
The only way you can do it is you do chelation by having EDTA, penicillin, which removes lead and mercury, have penicillamine, which removes others. But don't forget that 80% of the heavy metals, you can leach it by taking supplement like selenium, vitamin E, vitamin C. They have powerful also, and they can leach some of the heavy metals also. Not a lot, they can do some job. You follow me? But I just don't want people to think just by bathing or taking a shower, they got detoxified. And that doesn't work that way. Yes?
What are your nutritional recommendations for MS?
MS is the same thing exactly what we talked about it before. It's the same for MS as Parkinsons, as seizure. It's only the brain. The brain works with the same nutrients. There's no nutrients except lecithin for the MS that has more function for them. But DHA has been shown to help those patients, and also keeping it quiet, slowing it down by exercising and doing all the stuff we talked about, it does. I do have a MS patient. She had it for 30 years. She's still working. And I will supply you her name. You can talk to her. If you call my office, we'll give you her name because she accepted to take the phone call. Just 1 second. Yes, ma'am.
The alfalfa removes a cyst in the brain. My granddaughter was born with a brain hemorrhage. Is there anything that would reduce the cyst?
I don't think so. Alfalfa have lots of benefits that we can go a whole lecture about it, but to guarantee you it's going to reduce the cyst, I never seen it do that. Alfalfa had lots of other benefits, however. Yes?
Are you taking new patients?
We take new patients according to how serious they are, if we can help them. So when they call, they will be asking questions, what's your problem? And then if it is serious, we can help. We fed them within a week by canceling other patient, moving other patient to move a spot for them. A new patient takes 2 hours, follow up in the second, after that 1 hour. So that's so we take 1 new patient per day.
Call the office.
Yeah, call the office. Yes. Oh, just forget about it. It's a new things that in herbs and nutrition, you get it from vegetables that I skipped half of what I was going to say. There's about 30 nutrients I didn't even show on the screen. You know, it's not the only one. I didn't show zinc, I didn't show magnesium, manganese, and calcium, and B complex, and vitality. All this I didn't show. I'll do it next lecture. Yes, sir. The best way to get omega-3, you take Shaklee omega-3 because it has long chain, 21 carbon atoms. That's what you want. It is also have the mercury has been removed from it and the lead been removed from it. And that's probably the best source. Yes, in the way back. Yes, ma'am. Natural hormones? Natural hormones, we make it from Mexican wild yams. And patients who need hormones don't have to come to the office. They can call the office and they say, I want natural hormone for me, my age. And as long as they don't have cancer, we will send it to them and they don't have to come for a consultation. Yes, yes. No, there's one second. I have to take a man after. Yes.
Doctor, is 100, whatever you call that, MLS or whatever it is, of potassium, is that a lot for a human body to be low?
Oh yeah, because potassium is the main food for many things: brain, muscles, heart, you name it. And we are running with low sodium and low potassium and low magnesium and low manganese and low everything, and everybody's scaring you about salt, scaring you about this. You know, people are actually fatigued from lack of salt even.
How long would it take 100 of those things?
1 day. 1 day. Once you take it, it absorbs immediately.
No, I mean to be depleted, for the body to be
Depleted?
of that 100.
Probably about, the body consumes